So moving into the second half of the course, we're going to be talking now about the application of the literature that we found. How can we go about applying that into our normal clinical practice? Because that's what this evidence-based practice is all about. We have to take what we have learned and what we know, as well as what we find out from the patient, and apply that into clinical practice for this process to actually change our treatment approach and our outcomes. And so, as such, we'll spend some time learning about this process, as well as some specific tools that can help us throughout the application of the literature into clinical practice. And so I'd like to start here with Chapter 6 out of the Raab text. But I'm going to do it slightly differently than focusing primarily on what they focused on. But instead of what the authors were focusing on, which was very much describing what systematic reviews and meta-analysis are, we've already done that in our discussion of levels of evidence. But instead, I want to use the systematic review and meta-analysis process as an example of how we can go about making our own clinical decisions. So we'll start by talking about these levels of evidence because the level of evidence is going to be important as the foundation for making our clinical decisions. But then we're going to move quickly out of understanding the levels of evidence and instead into the actual making of decisions, and doing that through using systematic reviews and meta-analysis as the example. So if you remember on our discussions of levels of evidence, the idea here of the highest levels of evidence, meaning that they've been filtered for their meaning as well as the methods. And so the idea here is that in order to get to either a critically appraised topic, systematic review, or meta-analysis, the literature has gone through a subsequent review beyond the authors and the peer review process for its clinical utility. And so that's similar to what we've been doing with our critical appraisal. The nice thing is if you can find a critically appraised topic or systematic review or even a meta-analysis that has already been done for you, it saves a lot of time in the ability to not have to critically appraise all of the research yourself. If a systematic review has a similar clinical question that you have as well, you can use that information much more appropriately. Now, you will still have to apply that, and so the discussion that we have from here on out remains the same. But the idea here is as we go up the levels of evidence, we get more and more methodological quality as well as much more applicability as we start to get in this filtered information as well as the compilation study models that we discussed, where we now have a larger amount of total subjects. And so we talked in the levels of evidence discussion how although we have a single pyramid, each research question and therefore each study design has its own levels of evidence based on what is practical regarding that clinical question. And so although as we move up towards the higher levels of evidence, we can be more confident in their findings, we also need to realize that we cannot arbitrarily create ceilings where we're only going to analyze systematic reviews, for instance. We have a patient, we need to be able to come to some sort of decision in order to treat this patient, and a lack of evidence really does not help us at all in our treatment. So although lower levels of evidence does not allow for as confident of clinical application, they are still count as evidence, and we can continue along the same pattern that we've been doing. As such, we talked about those grades of recommendation. And really, those grades of recommendation are what we're focusing on here when it comes to application. The higher the level of evidence, the higher we can have our confidence in our application of that evidence. And so the process of accumulating, creating that grade of recommendation is similar to the process of application. So it's important as you go through and you do this entire process, both looking at critically appraised topics, systematic reviews, and meta-analysis, but also in this application process. The idea here is not to replace individual research studies, but instead to start to mesh research studies with our patient values as well as our clinical experience. And so we're trying to take all of this information, condense it, and then also apply it in the context of our decision. So a critically appraised topic, to remind you, is this idea of a one-page summary of the literature that is relevant to a specific topic. It's very clinic focused. And so when you think of these critically appraised topics, although a critically appraised topic often has more than one article, the process here is very similar to what we've been talking about with regards to our critical appraisal. So if you think about the critically appraised topic from a standpoint of step 4 application, this now is the process of looking at the individual articles or small groups of articles and appraising them individually. So we take each one of these articles that we have appraised, and we are now going to start the application process and see where it fits with the others. And so you see the different components. It starts with the same clinical question that we did with that, and then boils it down to a clinical bottom line. And you see that was the same thing that we were doing with our clinical appraisal. We were trying to come up with, based on the applicability of that research, and specifically that research with our question and by its own methodological quality, what can we use that information for? We then have to combine it with other forms of research, both our own clinical expertise and the patient values, but also hopefully in our search we found more than one research article, because a single research article gives us some level of understanding, but it's not as good as if we have consistent research all stating the same objectives. And so that's what the systematic review does, is systematically goes through this rigorous process of trying to identify all of the research. So it's the same thing with this clinical problem. That's what makes evidence-based medicine unique. You exhaustively search the literature, appraise the quality, combine them into a summary, and then place those findings into context. So this is exactly the same process now that we're going through in step 4. You see in step 1, the clinical problems there. Step 2, the exhaustive literature search. Step 3, the appraisal, and then 4, combining the results into a summary and placing those findings into context. And so if you think of this as the final steps of a systematic review, as well as the application step 4 of evidence-based practice, you can see these similarities that we're trying to focus on. So when you go through and how you go about doing this is going to be the exact same now as if you were critically appraising a systematic review that you found to try to answer your question. The idea very much comes into play on how focused was the clinical question, right? And so you have your clinical question that obviously is very focused, but now you have to first and foremost in the application go through and say, how focused is the literature that I found as an overall picture? So we now need to take that information and see how applicable is it. We also need to evaluate and apply our search as far as whether it's exhaustive, and we talked about the quality with that as well as the reproducibility. And so once we have those steps in mind, we can then go about trying to create our decision and then apply it. And so the meta-analysis is the statistical combination of several research studies, often part of a systematic review. And the main part of a meta-analysis is this forest plot. And the forest plot here is combining all of the different studies into a single graphic and then creating a new statistic out of that. And although you're not going to be creating a new statistic most of the time with your clinical applicability, a forest plot is a great way to start to apply your decision making. If you take each of the studies and apply them on a effect size type curve, and that's what we're looking at here, is mainly effect sizes, with that higher level effect sizes to the right, lower level effect sizes to the left, or favorability. And so we can see base here, the box represents the average for that study, and then the confidence interval is represented by the line, with studies on the right side indicating a effect of the intervention, and on the left side, no effect or negligible effect, or even possibly a control effect. And then you can see if it crosses that line, right, that more than likely occurred with a negative result. But you can see as we create a new statistic there, for the most part, we see most things over on the right side, which would indicate then to us that this intervention is effective. So based on that, if we've critically appraised the research, we've seen then that it matches our clinical question. We've done all that. It's reproducible, it's valid. We have a level of confidence with our search history as well as the applicability of our study. We can now go to and say, all right, because of this forest plot here, we see that most of it is on this right side favoring the results, and so we're going to apply it. So we're going to then take this intervention in this case, and we're going to apply it as described within the research studies as best we can. Now, each of these studies obviously had their own methodological interpretations of the intervention, and so in this case, the closer I can get to this study, the better. But we're going to take that methodological quality and the methodology of the research and apply that within our intervention. And we're going to actually then go through and just do it. So you get to the point where you've convinced yourself this is the best course of action based on the evidence, the patient values, as well as my clinical expertise. And so it's now time to apply this to the patient. From there, once you've applied it, you need to be able to evaluate its effectiveness, which ends up being step 5. But before we get into step 5, we need to talk about some of these different ways that we can apply and then measure our findings.